Total of 60,386 cases reported in the world, of which 59,804 in China, a total of 1,357 deaths, of which 2 were outside of China, 507 cases in Asia and Oceania, primarily that's the cruise ship off of, and Japan. Middle East, 8 cases, Europe, 46, United States, 14, and Canada remains at 7, of which 3 are in Ontario, and the others are in BC. The lab data for, as of 8 o'clock this morning, 306 confirmed negative, 16 presumptive negative, 15 are currently under investigation, and we have 2 confirmed positives and another one that has resolved, another case that resolved, the one in London. So, as you know, the WHO has now named the novel coronavirus COVID-19. So that is the term we're using now. And just happy to say all our confirmed cases in Ontario at least are clinically recovered, although, as you know, 2 are still in isolation and awaiting having 2 negative specimens at least 24 hours apart to be released. The sharp increase in cases has come after Hubei authorities said they had introduced a new, quicker diagnostic method using computerized tomography scans, CT scans, or CAT scans, which health authorities said had diagnosed over 13,000 of the new infections. CAT scans reveal lung infections and are quicker than the RNA tests that are done at throat or nose, nasopharyngeal swabs, which can take days to process in China. However, we're not really clear, as Dr. Williams alluded, on how to interpret this change, and there are a lot of questions to clarify the change in case definition, and I sit on the technical advisory committee of the Special Advisory Committee of the Federal Provincial Territorial Group, and that will be one of the technical questions we'll be looking at. So with that, I think I will turn it over to Dr. Vanessa Allen to talk about the lab.
Thanks, Dr. Yaffe. So there have been a couple of changes for the testing available in Ontario for COVID-19. The first one is that we've harmonized our testing at Public Health Ontario with the national lab, and it's also the same test that's occurring at the BC CDC. That happened on Friday. And we ran all specimens in parallel at Public Health Ontario as well as the national lab over the weekend, and they're concordant. And so that is a total of 81 individuals that were tested in parallel. 15 are still pending from the national lab. But the effort is really to harmonize all of the testing to make sure that we are leading at the edge of the testing availability nationally and provincially. And that has been the strategy thus far.
All right, Ontario officials at Queen's Park discussing these new diagnostic methods being used to test people for the coronavirus. With more on that, let's go to Geneva now, because the World Health Organization is giving its update on the coronavirus outbreak. Let's listen.
Many of us to look at the future post-Ebola of the health system in Congo. I'm sure we understand how important a task and a mission that is, given the last year and a half in Congo and the ongoing struggles in that country to deliver effective healthcare, reduce suffering and mortality from infectious diseases. Let me start by updating you on the latest numbers. In the last 24 hours, China has reported 1,820 laboratory confirmed cases, bringing the total cases to 46,550. In addition, China reported 13,332 clinically confirmed cases in Hubei province. And crucially, that most of these cases relate to a period going back over days and weeks and are retrospectively reported as cases since sometimes back to the beginning of the outbreak itself. So this increase that you've all seen in the last 24 hours is largely in part down to a change in how cases are being diagnosed and reported. So in other words, in Hubei province only, a trained medical professional can now classify a suspected case of COVID-19 as a clinically confirmed case on the basis of chest imaging rather than having to have a laboratory confirmation. This allows clinicians and report cases more quickly, not having to wait for lab confirmation, ensuring that people get to clinical care more. And also allows public health responses in terms of contact tracing and other important public health measures to be initiated. As you've noticed with suspect cases, there have been some backlogs in testing, and this is also going to help in ensuring that people get adequate care and that adequate public health measures could be taken. So we're not dealing, from what we understand, with a spike in cases of 14,000 on one day. To an extent, this is an artifact of the reporting, and we are working with our colleagues in China. Our team there are working very hard